Spinocerebellar ataxia, or SCA for short, is a genetic neurodegenerative disorder that mainly impacts the cerebellum of the brain and progressively gets worse over time. Damage appears as a decline in cognition, speech, vision, and more. SCA is a rare disease, with less than 200,000 individuals diagnosed in the United States, and over 40 different subtypes identified globally. The exact pathogenesis is still unknown, but is thought to be caused by a mutated gene having multiple repeats of the CAG nucleotides. These CAG repeats affect DNA replication, where copying mutated gene can lead to adding more CAG repeats. The more repeats there are of the CAG nucleotides, the earlier the disease can onset, and the symptoms can be worse. SCA is an autosomal dominant disease, which means only one parent needs a copy of the mutated gene to pass down. These mutations can either happen sporadically or by inheritance and usually occur on the paternal side. These mutations cause neuronal distress and aggregation, which ultimately leads to atrophy to the cerebellum, brainstem, and sometimes other areas of the cerebral cortex. Some of the symptoms of SCA include unstable gait, poor hand-eye coordination, slurred speech, involuntary eye movements, learning and memory disorders, and eventual loss of independence. Progressive cases can have symptoms like heart problems and dysphagia. Diagnosis of SCA can be done through genetic testing, gathering a family history, a thorough clinical examination of symptoms, and neuroimaging like MRI for identifying any atrophy. There is no cure for SCA, and the disease is irreversible once symptoms are present. Symptomatic treatment, like physiotherapy, may improve prognosis, but typically treatment is to improve the quality of life of patients. Most individuals require wheelchair support by about 10 to 15 years after the disease onset. CRISPR gene editing has been used to delete expanded CAG repeats in induced immature stem cells. Researchers are hoping to apply this in the future and potentially in clinical trials. You can find out more about SCA here in Hope for a Cure.